Hello everyone, I'm Hwajung Choi from University of Michigan, Department of Internal Medicine and Health Management and Policy. In this talk, we will review economic aspects of dementia focusing on evidence in the US. We will first review of the cost estimates of dementia. Then we will learn more about long-term care and out-of-pocket costs. We will also review family care availability for people with dementia and economic impact on care contributors. Okay, first overview of costs of dementia. Total healthcare payments for all persons aged 65 and older who has dementia are estimated as $321 billion in 2022. Medicare accounts for 45% of the total payment and Medicaid 19%. Out-of-pocket costs are also quite large, accounting for 25% of the total payment. How about the per-person payments? On average, annual per-person payments for healthcare and long-term care among people with dementia are about $42,000. Which is 3 times of the payments by those without dementia. As you can see here from this figure, regardless of sources, healthcare payments among people with dementia are substantially larger than without dementia. Medicare is about $21,000, Medicaid about $6,500, and out-of-pocket costs about $9,800 for people with dementia. Let's look at the healthcare payments by type of service. Payments for healthcare are much higher for people with dementia regardless of type of service, which is especially pronounced with nursing home payments. Average annual per-person payments for nursing home were about $13,000 for persons with dementia, while $500 for persons without dementia. There are studies estimating incremental costs of dementia, meaning costs attributable to dementia holding other things constant. One study focusing on Medicare expenditure using health and retirement study linked to Medicare claims data suggests 5-year cost to Medicare program is about $16,000 more per patient due to dementia. The incremental cost of dementia was greater for women than men by about $8,000. So far, we have focused on costs related to paid care services. In other words, we did not include the care costs of dementia related to care provided by family and other unpaid helpers. Hours of unpaid care for people with dementia are substantial. The estimated hours are 16 billion from 11 million family and other unpaid caregivers. Each week, about 27 hours per caregiver. The intense caregiving with at least 40 hours per week is especially prevalent among women and Black caregivers. To assess the complete cost of dementia, it is very important to include the unpaid care. Then the question is, how can we add monetary value to the unpaid care? In general, there are 2 approaches used to add economic value to care provided by family and other unpaid helpers. First, replacement cost approach, which uses the cost of equivalent service purchased in market through home health agency. Second, foregone wage approach, which uses the labor market income foregone due to the time spent on caregiving. For those employed caregivers, it will use a wage reported by the caregivers. For non-employed caregivers, it will use average wages for persons with similar socio-demographic characteristics. According to estimates by a study, the annual per-person unpaid care costs attributable to dementia differ a lot depending on which method was used. Based on foregone wage approach, it was about $13,000. However, based on replacement cost approach, it was over $27,000, which is more than double the amount based on foregone wage approach. After adding cost of healthcare purchased in marketplace, the total annual monetary costs of dementia was estimated as about $42,000 or $56,000, depending on methods used to calculate informal care costs. A study estimated total care costs for a person with dementia in the last 5 years of life. After including informal care costs, it was estimated as $287,000. This was much higher than the care costs of those who died of other causes, for example, by about $100,000 more than those who died of heart disease or cancer. We have overviewed the total care costs of dementia. I now want to share more evidence focusing on long-term care costs of dementia. Let's first review how much each of the following long-term care services would cost. Median cost of home health aid services in the U.S. is about $24 per hour. Adult day health care cost is about $74 per day or over $19,000 per year. The median cost of assisted living facility is $4,300 per month or over $51,000 per year. Nursing home would cost about $100,000 per year. However, the median household income of age 55 and older who will have dementia in 2 years is about $25,000. Therefore, most older adults in the U.S. cannot afford the long-term care services based on their income. According to the Congressional Research Service report, total spending on long-term services is $426 billion in 2019. The majority is by the public funding. In particular, Medicaid accounted for 43% and Medicare accounted for 21% of the total spending. 15% of the spending was covered by out-of-pocket costs and 9% by private long-term care insurance. Let's overview primary sources for long-term care, in particular Medicaid, Medicare, and private long-term care insurance. Medicaid covers nursing home care, which is the most expensive type of long-term care services. However, it only pays the amount that the nursing home resident cannot cover. In other words, the resident must spend all income, including Social Security income, except for a very small personal needs allowance. As I highlighted before, Medicaid payments for those with dementia were much greater than those without dementia. National Medicaid spending for dementia is estimated as $60 billion in 2022. Medicare covers a short stay in nursing home, such as rehabilitation after a hospital stay or some limited amount of in-home care. However, it does not cover custodial care in nursing facilities. According to 2016 Alzheimer's Association Family Impact of Alzheimer's Survey, the majority did not know how much Medicare would contribute to a nursing home service. 28% believed Medicare would cover nursing home care, and 37% did not know whether it would cover any of nursing home care services or not. Long-term care insurance may cover the cost of care provided in a nursing home, assisted living facility, daycare services, and in-home care. About 7 million in the United States had long-term care insurance in 2014, and the average annual premium was over $2,000 in 2010. Those with high income are significantly more likely to have a long-term care insurance. Despite the public spending, the out-of-pocket costs associated with dementia are quite large. In the next several slides, we will review out-of-pocket costs of dementia. The average annual per-person out-of-pocket payments among adults age 65 and older was almost $10,000, more than 4 times the out-of-pocket payments by those without dementia. Out-of-pocket spending from age 65 to death is greater for those with dementia compared to without dementia by about $38,000. Main contributing factor of the gap was spending on the nursing home. Out-of-pocket spending is significantly larger for white and richer individuals, as they have greater financial resources to spend down before they become eligible for Medicaid. Another study estimated out-of-pocket costs for patients with dementia in the last 5 years of life, which was about $62,000. It was 81% higher than the out-of-pocket cost to patients without dementia. How about racial differences in out-of-pocket costs in dementia? Again, focusing on the last 5 years of life. If we look at the out-of-pocket spending in terms of dollar amount, Black people were much less than non-Black people. However, the burden of out-of-pocket costs may not be less for Black people if we consider their financial resources. As you can see, the ratio of out-of-pocket costs to wealth was much greater for Black people compared to non-Black people. Family availability, especially availability of a spouse and adult children, is among the most significant resources that affect paid and unpaid care utilization over the course of dementia. According to a study that documented family availability, over 60% of people with dementia do not have a spouse. 24% have a spouse who does not have any limitations in daily activities, and 34% have a spouse who is not working full-time, assuming more available to care for the person with dementia. Most people with dementia have at least one adult child, and about half have 3 or more adult children. 59% have at least one adult child not working full-time. About 1 in 4 people with dementia has at least one adult child living in the same house, and over 40% have at least one adult child not co-resident but living close by. There are substantial differences in the availability of a spouse and adult children across demographic and socioeconomic groups. Spouse availability is much less among non-Hispanic Black people with dementia compared to non-Hispanic white or Hispanic. Also less for those who have a lower education and lower wealth. In contrast, the availability of adult children is much greater among non-Hispanic Black people with dementia compared to non-Hispanic white people with dementia. About 31% of non-Hispanic Black adults with dementia have at least one adult child living in the same house, but about 18% of non-Hispanic white people with dementia have a co-resident child. Hispanic adults have greatest availability of adult children. About 40% of them have an adult child living in the same house. Let's move to the last topic, which is economic impacts on dementia care contributors. On average, care contributors spend about $5,000 per year to take care of their relative or friend with dementia. Spouses spend the highest amount, but many adult children also spend over $10,000 per year. 63% of the care contributors reported they paid for food, and about half spent for travel and medical supplies for a person with dementia. Other expenses also include medication and medical or non-medical in-home care services. Let's look at the percentages of care contributors who took steps to help pay for the needs of their relative or friends with dementia. 48% of the care contributors reported they had to cut back on spending. 43% had to cut back on saving money. 20% reported they used their own retirement savings to help pay for dementia-related expenses. Some had to borrow from a friend or family and even sold assets. There are other financial impacts reported by care contributors. 20% reported that they had to cut back on going to doctors themselves. 11% cut back on buying medicine for themselves. And 35% reported of employment changes that reduced their income. This is the end of the talk. Thank you for watching and listening this review of economic aspects of dementia in the US.